Only on ABC 12 tonight, the CDC says McLaren Flint has been a source of Legionella bacteria growth for more than a decade. ABC 12 uncovered the letter saying the hospital has been a source of the bacteria since 2008. We first told you about issues with Legionella at the hospital back in 2014 during the water crisis. The state reported 90 people contracted Legionnaires disease in 2014 and 15, saying McLaren Flint Hospital was the common source for those cases. In documents we've uncovered, the CDC says it's been an issue at the hospital 6 years before the city switched its water source and was still connected to cases in 2019. Our Ann Perrette uncovered this information and has those details only on ABC 12. Joining us now live from McLaren Flint. And why are we learning this information 13 months later?
That is a question I have been working to answer. This letter is dated December of 2019. I just received it this week from a former state health director who says he obtained it after defense attorneys in the Flint water criminal investigation accidentally got a hold of it.
I've been sitting on this for several months, and it's been gnawing at me that this has not been put out.
Jim Haveman served as the state health director under Governors John Engler and Rick Snyder. This week, he sent me this 47-page letter from the CDC to MDHHS dated December 2019. The letter was never made public, but Haveman says what's included in it should be public knowledge. He didn't want to undermine the current state health director, but says he's waited long enough.
So the question to me as a citizen, I'm not a physician, is why wasn't questions raised about, hey, McLaren, what are you doing?
In the letter, an investigation of healthcare-associated Legionnaires disease in Flint, the CDC says from January 2018 to June 2019, 5 people contracted the illness, and they confirm 1, but believe all 5 are connected to McLaren Flint. 2 of those people died. We first reported in June of 2019, the state health department and state licensing agency issued orders requiring the hospital to address this risk. We've now learned the CDC came to town to investigate, and this letter breaks down what they found. It states scientific review, quote, raised concern that conditions supporting Legionella growth may continue to exist within the facility. The CDC also repeatedly points out, quote, a particular strain of Legionella identified in the McLaren Flint water system has been associated with the disease for more than a decade, dating back to 2008, 6 years before the city's water source switch. So the CDC states something needs to be done to, quote, eradicate this outbreak strain from all building water systems in order to protect patients, visitors, and staff from exposure to Legionella. While on the ground in Flint, the CDC investigation team reviewed the hospital's water management program put in place in 2016. The conclusion, the letter states, McLaren Flint focuses on the hot water systems, which is reducing the risk of Legionella, but not eradicating it. And, quote, when Legionella environmental sampling has been expanded to the cold water system in the course of case response or efforts to investigate issues at points of use, Legionella was detected. The letter states ice machines, faucets, and shower heads have tested positive for the bacteria, and so have drinking water fountains. A concern, quote, it is possible that the drinking fountains could be contaminated between the filter and the point of use, meaning that the inline filters may not be preventing Legionella transmission. 5 pages of recommendations from the CDC follow, including the use of point of use filters, taking ice machines and water fountains out of service until they're disinfected and tested. Test all patients with pneumonia for Legionella. Train clinicians on how to diagnose and treat Legionnaires disease. The CDC also provided guidance to their water management team to strengthen their testing measures. And the CDC makes it clear that it's up to the state to make sure that those recommendations are followed and make a difference in eradicating the risk for Legionella growth and transmission. I have reached out to both the state and McLaren Flint to find out 13 months later, is the hospital still considered at risk for spreading the bacteria? Those answers tonight at 6. For now, live in Flint, I'm Ann Perrette, ABC 12 News.
And thank you. As Ann mentioned, this report says 5 people contracted Legionnaires. So let's take a look at those cases. The 5 patients ranged in age from 50 to 70 years old. 3 were women, All 5 had chronic underlying illnesses, and they all required inpatient treatment in the ICU for Legionnaires. Sadly, 2 died from the disease. And developing now, many of those deaths from the water crisis were linked to Legionnaires' disease in Flint. The majority of those traced to McLaren Flint. Tonight, we have some new information related to the hospital's decade-long history of Legionella growth in their facility. The CDC says it started well before the water crisis and continued years after. We first told you about this on ABC 12 News at 6. The CDC sent a letter to the state saying at least 1, but possibly 5 people contracted Legionnaires' disease at McLaren Flint between 2018 and 19. We're going to turn now to our Ann Perrette, who joins us now live from the hospital. And Ann, that letter is dated December 2019. Since then, what's been done, and why wasn't this report made public in the first place?
Well, I gave the state health department and McLaren Flint 24 hours to respond after I received the letter. We first shared with you at 5 the list of recommendations the CDC asked the hospital to comply with. So where are we at with that? Did those changes happen? And 13 months later, is the hospital still considered at risk for spreading the bacteria? The December 2019 letter from the CDC to state officials says McLaren Flint has been a source of Legionella since 2008. That date is significant. Back in 2019, when the state health department linked new cases of Legionnaires' disease to the hospital claimed that all cases had been linked to when the city changed its water source. Last June, McLaren gave us this statement, quote, "We believe this order is unfounded and represents the state's continuous efforts to shift blame for their bad decisions made 5 years ago onto our hospital." 5 years prior to 2019 is 2014, when Flint changed its water source. Between 2014 and 2015, the state reported 90 cases of Legionnaires' disease and said most of those had a connection to McLaren Flint. Now, we've learned in the December 2019 letter, the CDC is saying McLaren Flint has been a source of contamination since 6 years before that, starting in 2008. In that letter, the CDC listed recommendations for changes the hospital needed to make to eradicate Legionella. We asked McLaren what they've done on this list in the past 13 months. The hospital wouldn't get specific, instead saying they're in compliance and regularly update the state on their water management program. A spokesperson issuing a statement saying in part, quote, "McLaren Flint maintains a stringent, highly monitored water management program. It was designed by some of the nation's leading water experts and is routinely reviewed by both internal and external environmental safety professionals." She added they've, quote, "had no further communication from the agency on this matter since January of last year." But the question remains, if the state initially told us about this potentially deadly risk in June 2019, why didn't they keep the public informed as more information came out? Neither McLaren Flint nor the state health department chose to answer. But a spokesperson for MDHHS did point out, quote, "No healthcare associated cases of Legionnaires' disease have been reported to MDHHS by McLaren Flint Hospital during 2020. And this new information now begs the question, did we see an uptick in Legionnaires' disease cases in Genesee County in 2014 and 2015 as a result of Flint's water source switch? Or did the switch exacerbate an already existing problem? I am working to get that answer. Stay with us as we can continue following this developing story. Live in Flint tonight, I'm Ann Perrette, ABC 12 News.
The city's water supply was switched in an effort to save money. That decision is blamed for a deadly outbreak of Legionnaires' disease at McLaren Flint. We were the first to share with you Tuesday a letter from the CDC to the state health department sharing McLaren Flint has actually been a source of Legionella bacteria for more than a decade, since 2008. That is 6 years prior to the city's water source switch. The letter is dated December of 2019, but was never made public. Our Ann Perrette obtained it, dug into the facts. She joins us now live from outside McLaren Flint. And Ann, several experts reach out to weigh in on what you uncovered.
Yes, now since we first aired the contents of this letter, I have had water experts from across the world connecting with me. If you remember, I mentioned in our coverage yesterday that this new information begs the question, did we see an uptick in Legionnaires' disease cases in 2014 and 2015 as a result of the city's water source switch, or did the switch just exacerbate an already existing problem?
Very likely what happened was the switchover exacerbated conditions that were already there.
Tim Keene is a consulting engineer on Legionella. For 2 decades, he's been tasked with identifying issues within water systems, specifically to determine if that system is a source for Legionella growth.
McLaren already had issues with their water systems when it was audited by CDC that identified temperature issues, circulation issues. So those were all in existence prior to the outbreak.
The outbreak following Flint's water source switch in 2014. A total of 90 Legionnaires disease cases were reported over 2014 into 2015. At least a dozen people died. The state saying a majority of the cases are connected to McLaren Flint. The hospital has maintained the outbreak was because of the water switch. But in this letter we first shared with you Tuesday, the CDC says the hospital has been a source of the Legionella bacteria since 2008 through 2019. Keene wasn't surprised the issue has persisted for more than a decade. He says due to McLaren Flint's end of the water distribution system, the hospital has a high water aging issue.
That means you're at the end of the system, and you know about stuff rolling downhill. So you'll not only have less disinfectant, you'll have crud building up. I've flushed out these mains at high velocity where you get this septic, nasty crud that's coming out because it's settled over a period of months.
So Keene says that's how the water source switch exacerbated McLaren's existing problem. We know the Flint River water wasn't properly treated, and without the corrosion control, Keene says the chlorine used to treat the water and control the bacteria becomes non-existent at the end of the distribution where McLaren was located.
This lack of disinfectant residual turned what was likely few cases unidentified into a large cluster.
And I did reach out again to McLaren asking for an on-camera interview today. Instead, they sent me that the water source switch is to blame for the uptick of Legionnaires disease cases, even noting the timing of the letter being made public. A spokesperson issuing this statement saying, quote, "It is disappointing that our hospital is once again being forced to defend itself against this false and misleading narrative advanced by these individuals and their defenders as they prepare to face criminal charges, in some cases for a second time." Now, it is important to note that the state shared with us yesterday that in 2020, McLaren Flint did not report any healthcare associated cases of Legionnaires disease to them. Live in Flint tonight, I'm Ann Perrette, ABC 12 News.
And thank you. Meanwhile,